My voice isn't sounding that brilliant either, is it? This thing will not go. Now, worrying new figures show that the number of flu cases in hospital is a whopping 7 times higher than last month, intensifying the pressure on our struggling health service. According to NHS England, there were 3,746 patients a day in hospital with flu last week, up from 520 a month ago and just 34 this time last year. Of those in hospital last week, 267 were in critical care beds. So what can be done to help the NHS as it battles this spike in winter sickness? Let's talk to our West Midlands reporter, Jack Carson, who's outside a hospital in Birmingham for more on this now. How are things at the moment there in Birmingham?
Well, here and in Birmingham, over 400 people are now in hospital with flu across the University Birmingham Hospital. Hospitals. It follows this worrying trend in the rise of flu cases. Professor Drew Perek, who's the associate editor of who's the associate professor in acute and critical care and consultant in critical care at the University Hospital Birmingham here, said that we're seeing a worrying number of patients being admitted to our hospital and our critical care units with respiratory failure as a result of flu infection, and it's of course the same trend being shown around the country. He said we haven't seen these numbers of serious flu infections since before the COVID-19 pandemic, and never at this level. So it's concerning for many patients to be admitted with flu. Of course, we know that around 79% more cases of flu in the last week. That rising, that kind of worrying rise. It was just 772 at the start of this month, but as you mentioned, now nearly 4,000 people a day across hospitals in the UK are being admitted with flu, and with critical care patients in the 7 days running up to Christmas, it was around 149 and then 267. So it is worrying that so many people are being admitted to critical care, because of course when you get to critical care, the only real treatments for flu are of course oxygen and other kind of real kind of minor treatments, because the main protection against flu is the flu vaccination, which the NHS are urging people to get in order to give themselves the best protection this winter. But even that doesn't stop you technically getting flu. It just dramatically reduces the chances that you'll end up with a serious illness from it. But there is also a near record demand for the 111 service as well, with 721,000 calls to that service last week. Of course, that's a mix of parents worried about the rising cases of strep A, but also people calling up wondering how on earth they can treat themselves for flu. The NHS says they've prepared extensively for winter to manage the rising demand, as well as of course this industrial action that's been taking place. But what doesn't help is that of course, as lots of people around the country are sick, nurses being in hospitals around those patients also can get sick as well, and so it's nurse absences which is affecting how the NHS and the levels of care the NHS can give to patients. An average of 60,500 staff were off sick every day last week. That's almost up a fifth on last month. And of course, the reasons people and flu kind of rises, it depends all on things like weather, but also to do with, of course, mixing. This is the first Christmas in a good few years that actually people have been able to come together properly and mixing, and so infection is naturally more likely to spread a bit more than it has done in the previous years. But Professor Sir Stephen Powis, who's the NHS National Medical Director, has said that that with more industrial action scheduled for next week, there will be disruption, but we urge the public to continue to use the services wisely, calling 999 for life-threatening emergency and 111 for those other health conditions, and taking sensible steps to keep yourself and others safe.
Yes, and you keep warm. It looks a bit chilly up there in Birmingham at the moment, but thanks very much indeed for that, Jack.